up with the Wolverine. Wow!
The term plank owner in the Navy is a very significant thing when it comes to a commissioning or an opening of a ship or a unit. Even the Navy SEALs, when they commission a new unit, it's referred to as those staff, those people that made it happen, are plank owners. Well, today, the people standing in front of you are ribbon owners. We made this happen together. This is a team, this is broad, this is important. So as you cut this ribbon today, know none of this is possible without you, and this is bragging rights to all school-based clinics in the future and all people that follow you. You were here, you made it happen, and you are an owner. Thank you.
3, 2, 1. Keep your section. You are a ribbon owner. This is important. I've got to pass that.
Alright, so who am I here with today?
So I'm Ashley Atkois. I am a nurse practitioner for Sterling Area Health Center, and I run the Augrey Sims School-Based Health Clinic.
I'm Amanda Forsmark. I am the Director of School-Based Programs, so I oversee all 6 of our school-based health center sites on the admin side.
Alright, so tell us about this community health center.
Well, we provide primary care and behavioral health services here, so that's anything from like a sports physical, which we know that season is coming up very soon, a well child exam, vaccines or shots. If you're sick, you can come here and get seen. We can provide medication if needed. We can write prescriptions even depending on what you're sick with. If you're hurt, if you need therapy of any kind, all of those services we can offer. We also have confidential services for kids as well.
Alright, kids, like who can come here? Like who all is allowed to come?
So here at our school-based clinic, we are seeing kids from the ages of 3 to 21. And that can also be kids that are homeschooled, so don't necessarily go to school here at Augrey Sims. We're also seeing siblings, so if you have an older sister or brother, but you have a sister or brother or at home, they can come in and be seen. And then we're also seeing all Augrey Sims school staff right now. So if you're employed, you're a coach, you're a parapro, you work in the kitchen, you're a teacher, you're office, whatever, you can come into the clinic and be seen for whatever reason.
Is this an urgent care provider?
It can be. It can also be like a primary care office where if you don't have a primary care provider, a physician, an NP, a PA, that you can come in and get well child checks. And like Amanda was saying, you can do confidential testing like pregnancy testing, STI testing, and you can also do sports physicals. But you can also utilize it as an urgent care. Say you have a primary care provider that you see on a regular basis, but you have a sick visit and you can't get in for 3 days, 4 days, 6 weeks, you can stop in here and be seen.
Alright.
And we talk with your primary care doc. So let's say you come in here for a strep test, your strep test is positive, we would then send the notes to your primary care doc. Or kids that have asthma or diabetes and might need some support additionally to what they get with their doctor, we can see those kids as well, or adults, and then we can fax the notes over to their primary care doc. So they don't have to pick us or their doctor, they can see both.
Alright.
Alright, so what is the most important thing when it comes to the health clinic?
So the absolute number one most important thing that you can do to be seen in the health clinic is fill out this packet, okay? You need it to be seen here. If you're under the age of 18, you have to have it filled out by a parent. If you're over the age of 18, you can fill it out yourself. Either way, under the age of 18, you fill it out once until you turn 18, and then over the age of 18, you fill it out once until you age out of our program, which is 22. So out.
Fill out the packet. They are available in the main office. They are available in the health center.
We can do a treatment here. So we do have emergency medications for allergic reactions. We also have medications, like if you have asthma and you're having an asthma attack, we can give you a breathing treatment. We can also give you some Solumedrol if we need to give you a steroid of any sort, in addition to a number of other things, like we were talking about antibiotic treatments and so on and so forth. So this is the exam room. It's pretty simple. Again, we have some of our equipment over here. We do have a light to be able to look into your eyes. We have this exam table, comes up, comes down. We have all sorts of different things in here that we would evaluate you with, okay?
Could you have a prescription written?
Oh,
And
yeah.
What kind of like prescriptions don't you write?
So I can write prescriptions. Couple things that we definitely work with is antibiotics, steroid packs, things of that nature. If there's medication that you guys are on long term, we can do refills of medications, especially if there's antidepressants or anti-anxiety medications that somebody has been on for a long time, or even if that's something that you're interested in getting started. Some things that we do not do here in the clinic is we do not prescribe birth control. That is something that we can talk about birth control about. We can come up with a contraceptive plan, but we do not prescribe it here. We would have to send you to another one of our sites, whether it's the main Sterling clinic or to your primary care to actually give you that prescription. And a lot of times I don't know that there would be a reason for us to do any narcotics here. That would also be another scenario. I mean, we would have to talk about it a little bit. But yeah, that would not likely be something that we're prescribing here in the school-based clinic.
So can you receive an early dismissal if you're sick? Like if you are diagnosed, like you're sick, you have the stomach flu or a cold or something?
Yeah, we would write you a note. And again, obviously, if you're throwing up, you're sick to your stomach, anything like that, or you have a fever, it's reasonable to send you home. Obviously, you don't want to get somebody else sick. And then we write you a note depending on how we feel you're doing clinically and, is it appropriate? This is where kind of all of our supplies are. We have bandages, sterile supplies, breathing treatments, all sorts of stuff back here. And then where Amanda's standing is our behavioral health room. So once we do get a social worker and behavioral health counselor specialist, you will be able to have behavioral health services done here in the clinic. And those can also be done during school hours. You'll come right in here. It's very private and you talk to somebody one-on-one. Okay. And then back this way, this is kind of where our lab is going to be. So this is actually our vaccine refrigerator. It doesn't have anything in it yet because for it's a month or 2 months, Amanda, 1 month, we have to make sure that the temperatures are appropriate because once we get all these vaccines in, we have to make sure that it's staying cold because otherwise we lose a lot of money if vaccines go bad. And then again, this is some of our lab equipment. We're still kind of moving in and putting stuff away right now, but we have needles and syringes to be able to give injections, vaccines, anything of that nature. Over here is some of our lab work, or lab equipment, I'm sorry. So we have that. We have, I don't know if I have a key. I think it's all locked. It is. We have our little tubes. We have swabs. We have all the things to be able to test for strep, for COVID, influenza, all of those things. So we can provide all those services here at the school-based health clinic as well.
We are open all summer long. So we're not just open during the school year. We have our own entrance on the outside, so we can show you that just so you know, in the summertime, people can actually come right up to that door just in case there's nobody in the main office. But we're open on Tuesdays, Thursdays, and Fridays, the school day, so 7:30 till 4. But we are open all summer. A lot of people wonder about that. So if people need sports physicals over the summer, you don't feel well, come see us.
And I was going to mention, because tomorrow is April 15th, it's sports physical day for the new year. So for the 26-27 sports year, you can start getting your sports physicals as of tomorrow. So give us a call.
989-654-2491. And then you pick option 1 for school-based health centers and option 6 for our Gray Sims. And even if we're not here, because like I mentioned, we're open Tuesday, Thursday, Friday, you can leave us a message and somebody from our team will give you a call back and get you scheduled.
Absolutely. Okay, and we'll show you the outside door just so you know that you can come this way.
Don't do that during school, but in the summertime.
Right.
So
Here we are, the backside of Aubrey Sims. And yeah.
we got a
Oh, yeah.
overhang so you
We
can
have the,
know where to find us.
don't fall off the thing, but yeah.
Wolverine, wake up.